Hello, everyone, and thank you for joining us today. My name is Dr. Mariska Brown, and I'm currently Program Director for Sleep Disorders Medicine and the National Center on Sleep Disorders Research in the Division of Lung Diseases at the National Heart, Lung, and Blood Institute. Today, Dr. Chandra Jackson and I will be having an informal conversation to discuss sleep during the COVID-19 pandemic. Dr. Jackson?
Hello, everyone. I am Dr. Chandra Jackson, an epidemiologist and research investigator at the National Institutes of Health. At NIH, I direct a research program investigating the social and environmental determinants of sleep health as either protective against or a risk factor for common conditions, including type 2 diabetes and cardiovascular disease. And I'm certainly delighted to share virtual space and time with you all during this much needed conversation.
So, Dr. Jackson, from a sleep perspective, can you tell us how the pandemic is affecting people?
Certainly. We knew before the pandemic that at least a third of Americans were not getting the recommended amount of at least 7 hours of sleep per day. And before coronavirus, millions of people suffered from sleep disorders like insomnia, which is characterized as difficulty falling or staying asleep over an extended period. And that's usually at least 3 months. And it's likely that the stress that many of us had before the pandemic has now increased. For instance, if people already feel isolated and depressed, it could be more difficult now to cope, especially if loved ones are sick or have passed away. Some may also feel greater financial strain or job and housing insecurity. Unfortunately, many new challenges have also emerged. And one obvious factor is that being or knowing an essential worker on the front lines, whether a medical doctor, nurse, or a cashier at a grocery store, that can induce anxiety, which we know negatively affects sleep. Also, our routines have been disrupted, and it can be rather difficult to adjust to this new way of living. We're staying at home, which we should acknowledge is not a safe and comfortable place for everyone. And keeping track of time can be difficult without the typical time cues, like getting dressed for work in the morning and dropping kids off at school at a standard time. And so other major challenges relate to being able to cut off work at the end of the workday because you're at home, or being sufficiently productive while working and managing a house with children who are used to being at school and may be getting too much screen time. So all of these factors many of us have been dealing with can cause stress and strain shown to negatively affect sleep. Additionally, simply staying home in the house versus going outside can greatly lower your exposure to natural light. Just think, bedrooms have approximately 200 to 300 lux. That's a measure of visible light, but the lux outside with bright light is a whopping 110,000 lux. So this lack of natural light can reduce biological signals that are important for sleep at night and for keeping our circadian rhythms properly aligned with the external environment. And for those who may be unfamiliar, your circadian rhythms are your internal biological processes that follow an approximately 24-hour rhythm. And so we're all undoubtedly affected by the pandemic in different ways. And it seems that many people are either sleeping less or longer than they need to, which can make people feel groggy, unfocused, and even irritable throughout the day. Some are sleeping at different times or getting a lower quality of sleep than before the pandemic. But either way, we know that optimizing your sleep helps with energy levels, emotional wellness, and mental health, the immune system, and brain function. And that includes learning and memory.
So, that's some really great information, particularly pertaining to sleep and rhythms and stress. So, stress impacts sleep. How does disrupted sleep actually affect the immune system?
That's a great, timely question, of course. So, good sleep actually bolsters or helps support the immune system, but disrupted sleep, however, can reduce the amount of circulating cytokines. And this is a type of protein that helps protect against the common cold, for instance, which clearly has implications for being able to ward off infectious agents like coronavirus. And if you're actually sick for whatever reason, resting your body seems to help you recover faster. Lastly, chronic sleep has also been shown actually to make vaccines less effective by reducing the body's ability to respond.
Absolutely. And earlier on, much of the focus on COVID-19 was on the respiratory system and the immune system. However, recently there's been an acknowledgement that other systems in the body are impacted by COVID. Every day we read studies pertaining to the effects on the neurological system, such as stroke and delirium, and the cardiovascular effects like arrhythmias, even among patients who experience mild cases of the virus. In addition, the effects of COVID can persist. There are some accounts from people who have acquired and survived COVID that they still experience fatigue, brain fog, sleep disturbance, and delirium. Also, the sleep of patients who've experienced the most severe respiratory symptoms and who needed prolonged ICU stay showed decreased sleep quality in terms of efficiency and fragmentation. There was actually a recent article published in Science magazine that discussed some of these lingering problems. And in addition to the fatigue and foggy thinking, survivors experienced shortness of breath, insomnia, persistent loss of smell, and damage to the lungs, heart, kidney, and brain. So, Chandra, how does sleep affect other outcomes our viewers may be interested in? For instance, the pre existing conditions are associated with more severe consequences of COVID.
Hmm. Sure, great question. So, we know sleep has wide ranging benefits for both physical and mental health. Therefore, poor sleep can have a wide range of adverse effects and actually has been associated with an increased risk of, for instance, obesity. So, experimental and observational research studies have found that not getting enough sleep is associated with an upregulation or increase in ghrelin, which is a stomach hormone that increases hunger, and also a downregulation or a decrease in leptin, which is a hormone secreted by adipose or fat tissue that reduces your level of satiety or satisfaction. Additionally, even acute sleep loss can lead to brain activity that enhances overeating or cravings, and not for broccoli, but for sweet and salty foods. So, when sleep deprived, you are also less likely to engage in physical activity, which we know can help with weight management. And so all these factors can increase one's risk for obesity. And we know that obesity is the strongest risk factor for type 2 diabetes. And in this case, not getting enough sleep can interfere with maintaining ideal insulin and blood sugar levels. Also, poor sleep likely increases hypertension risk. I'm sure that's a surprise to many, but during normal sleep, there is usually a decrease in blood pressure compared to when you're awake. So, sleep disruptions can lead to non dipping of blood pressure, which can increase your risk of hypertension. Studies have implicated poor sleep in increasing risk for more hormone sensitive cancers like breast cancer. As just one example, melatonin, a hormone that helps you sleep, is also a well known anti inflammatory and antioxidant that could help fight against cancer. So, if your melatonin is suppressed, let's say because you're a shift worker exposed to artificial light at night, perhaps this contributes to an increased risk. There also seems to be an increased risk of cardiovascular disease because sleep disruption increases inflammation and oxidative stress. So it's worth noting that certainly having these health conditions already can also impact your sleep, creating maybe a vicious cycle. So all the more reason to prioritize your sleep if you already have been diagnosed with these conditions. And sadly, preventable disparities in both sleep and health outcomes exist across various social identity groups like race and ethnicity.
So you mentioned health disparities. So, given the social climate and the increased awareness pertaining to disparities, as well as the impact of COVID-19 on these underrepresented or under-resourced communities, can you speak to the role of disparities in sleep and its interplay with COVID-19?
Certainly, I'm glad you asked. Unfavorable sleep is all too common in the general population to begin with, but minoritized individuals like those who are Black or African American, Hispanic or Latinx, Native American, and even sexual and gender minorities have been shown to be disproportionately burdened by poor sleep. And social stress is actually generally believed to be the connection across these different but intersecting social identity groups. For instance, minoritized groups, especially African Americans, are generally less likely to get the recommended amount of sleep. And again, that's 7 hours on a daily basis. Less likely to get sufficient amounts of slow wave sleep, which we sleep researchers consider the most physiologically restorative stage in terms of, for instance, cellular and tissue growth as well as repair. There's greater variability in sleep timing and higher likelihood of circadian misalignment that appears more common among African Americans, which could, at least in part, be attributed to social factors like preferences in recreational activities, being night shift workers, or having unpredictable work schedules where it's difficult to juggle life demands. In terms of sleep disorders, the most common are, let's say, obstructive sleep apnea and insomnia. Black or African American, Hispanic or Latinx, and Asian populations actually suffer disproportionately from obstructive sleep apnea, where hallmark characteristics include being excessively tired during the day, snoring loudly, and going sometimes relatively long periods of time where breathing actually stops during sleep. So, alarmingly, these disparities appear to start early in life. For instance, Black compared to white children have a 4 to 6 times higher prevalence of sleep disordered breathing, which is attributed not to genetics, but to living in economically deprived communities with relevant environmental hazards like allergens. So, pre-existing sleep disparities are clearly relevant to the pandemic, as poor sleep likely contributes to disparities in immunocompromising outcomes like diabetes and cardiovascular disease. And these are conditions that we know increase susceptibility to poor outcomes related to COVID-19. Additionally, the mental stress from COVID that we're all feeling will likely be exacerbating the existing sleep disparities because disadvantaged groups are disproportionately affected by the virus. But I do want to end by making it clear that these minoritized communities are not innately risk factors themselves, but are essentially placed at risk. And racism is the risk factor. For instance, these days, it's no longer a surprise to many that we live in a race conscious society with a historical and contemporary legacy of racism, where social structures like formal policies have led to the main drivers of health disparities, namely racial, residential, and occupational segregation. And so these remain uncorrected and they still exist. And so this has left minoritized groups being more likely to have service oriented, essential frontline, and often risky low wage jobs without worker protections like paid sick leave. And this reveals the hypocrisy of workers being considered simultaneously essential yet disposable. So these groups are also more likely to live in substandard, intergenerational, multifamily housing where it's more difficult to socially distance and where ventilation may be poor, understanding that the virus is to some extent airborne and may potentially travel through a ventilation system. So essentially, the long-term solutions need to be centered around reconciling social ills of the past and addressing institutional racism. And in the short term, addressing the social determinants of health we think so much about, relating to community investments and environmental justice, healthy homes, and economic opportunities that include livable wages, which we know can all influence sleep and subsequent health outcomes.
Thank you, Chandra. That was some great information that you gave us. So now, given the impact of sleep loss, whether it's to sleep disorders or whether it's related to sleep deficiency, and seeing these connections of sleep loss on the body, I'm sure the viewers online would actually want to be interested in to know how one
Mm.
determines whether they are a good sleeper or not.
Absolutely. I'm sure that's why people are watching. So there are several dimensions of sleep that appear independently important for health. And so if you're a good sleeper, then you are routinely getting at least 7 hours of good quality, uninterrupted sleep as recommended by the American Academy of Sleep Medicine and the Sleep Research Society. Interestingly, many think they function well after getting just a few hours of sleep, but typically we're actually not a great judge of our own vigilance and often make mistakes more than we think, some of which can be rather dangerous. So imagine driving a car while trying to function off of a few hours of sleep. In fact, driving while drowsy or sleep deprived has been shown to be just as deadly as drunk driving. So, in addition to adequate duration, appropriate timing of sleep is also necessary and entails alignment between when your internal biological rhythms want you to sleep, which is at night, and when you actually sleep. And so night shift work is a good example because the worker is up and working at night, but human bodies are hardwired to sleep at night. And so this misalignment could be detrimental to health. Another factor important for good sleep is sustained alertness when alert and active, and not feeling sleepy when you wish to be alert. That's actually quite important. So, what we refer to as high sleep efficiency is important, which means you spend at least 85% of your time in bed actually sleeping when you wish to be asleep. You should also just simply be satisfied with the sleep you're getting and feel refreshed when you wake up. And so, all of these should occur on a consistent basis. So now I think you should rest assured that everyone has trouble with sleep from time to time. And usually everyone also has at least some room for improvement. So I encourage those listening to, no matter how good a sleeper you think you are, work on optimizing your own sleep.
Absolutely. So, in addition to getting bright light early in the morning and avoiding bright light at night, being helpful for most of us, can you offer some practical tips for obtaining optimal sleep?
Certainly. There are a number of tips, with some being easier to implement than others. For instance, it is important to simply decide to make sleep a priority. It's actually just as important as nutrition through a healthy diet and physical activity. So you need to first establish a healthy bedtime routine, which is even more important during this pandemic since daily routines have been disrupted for most, if not all of us. Ideally, stick to a sleep schedule, meaning pick consistent times to turn off lights, go to bed, and try to fall asleep, as well as wake up at the same time each day, even on weekends. So if you need to, set your alarm and don't use a snooze option. Also, practice a relaxing bedtime ritual where you wind down from the day. For instance, do what puts you at ease, such as meditate, take a bath or shower, listen to soft, gentle music, or read a book, but avoid tablets without the blue light filter, since melatonin production can be suppressed, especially by blue light. Even creating time cues for your daily activities can be helpful, such as eating healthy meals at the same time each day. and blocking off time for work and exercise, preferably out in nature, while of course engaging in social or physical distancing. Reserve your bedroom for sleep and connecting with your partner in order to create a mental association between your bedroom and sleep. You can also create a comfortable and inviting setting for sleep through the following options. For instance, keep your bedroom cool or your ideal temperature and humidity. Keep the bedroom dark, but use a night light for safety if necessary. But preferably no light from the television. Um, and as you mentioned, Dr. Brown, seek bright light during the day, especially in the morning, because that enhances alertness. That'll be useful throughout the day. And also avoid bright light at night, especially in the middle of the night. You could use blackout curtains or eye masks, especially if exposed to artificial light in urban areas. Try to free your space from disturbing noises, and if necessary, use earplugs. And actually, some people enjoy and find light or white noise, excuse me, rather soothing. So essentially, figure out what works best for you. Determine the type of mattress and pillows that are comfortable to you and your partner, and keep your sheets and pillows clean. Also, beware of hidden sleep stealers by hours before bed, turning off electronics and avoiding excessive or heavy food and liquid intake. Avoid caffeine in coffee, and I'm sure everyone doesn't know that there's a trace amount of caffeination in decaffeinated coffee. There's also caffeine in chocolate, my weakness, along with avoiding nicotine and alcohol. And so this is an important point because many people consume alcohol before bed thinking it will help them fall asleep, but it may make you fall asleep more readily than without the alcohol, but it turns out to fragment or disrupt your sleep in the second half, thereby reducing the quality. And so if you can't sleep because your mind is racing, like many of us, then write down your thoughts and concerns, or your to-do list for the next day before going to bed. And this will help clear your mind, which may help you fall asleep. Also, focus on the present and try not to catastrophize, since this anticipation of what may happen in the future could contribute to anxiety. If you stay present, then you can also help reduce feelings of anxiety. And so, if you still can't sleep well, avoid obsessively watching the clock. It actually can make matters worse. If tired, take a brief nap, knowing that it's best to avoid long naps or naps later in the day, because that can hinder your nighttime sleep. Lastly, you should see your physician if you're concerned about anything we've discussed during this session, or also see your physician if you have difficulty falling asleep, difficulty sleeping until the morning, sleeping through the night. Someone told you that you snore loudly or stop breathing in your sleep, or if you find yourself falling asleep when you don't wish to. And so those are my tips. I hope they're useful.
So those are some great and actually very practical tips, Chandra. So thank you very much for those. And thank you all for tuning in. That concludes our session on sleep and health, coping with the COVID-19 pandemic. Here's to sweet dreams and good health. Good day, everyone.